Hi, it's Dr. Janowski for Sonata. Today I want to talk about Botox or Dysport injections. Botox and Dysport and Xeomin are the medicines that we're familiar with that reduce the motion in the upper face, between the brows, forehead, crow's feet area. And this is usually the first treatment that someone gets when they kind of wade into these types of treatments, and it makes them nervous. They don't know what to expect. And there's many different ways, techniques to inject these products, but really, especially because patients are new to it, we want it to really be a very easy, very comfortable, no fear, no minimal pain, if none, procedure. So there are certain techniques that we use to achieve that result. It's very fast, at least in my hands, the way it's done is a minute, 2 minutes, so patients shouldn't feel like they're going to need to sit in a chair for a very long time. If we're going to use Botox or Dysport, I prefer Dysport because most patients feel like it lasts a little bit longer and it's less expensive. But they do essentially the same thing. And the most important thing to do in order to make this a really breezy, easy procedure is the technique that I use for injection. And so the first thing that we do is we use very, very small, what's called insulin needles there. This is pretty much the smallest needle you can get. You can barely see it. So we need to use a very small needle, a very short needle. And then the key is what I call the snap technique, getting it in quickly through the skin, because the skin is where you're going to feel it, and then we inject it down where the muscle is. So patients really tell me that they barely feel it. They've had injections elsewhere, and they always come back to me because they feel like it's so easy the way I do it, at least compared to other injectors. So I will demonstrate what I call the snap technique using Dysport. So we're about to use the snap technique. This is a technique that's what I call it, just for easy injection. The other thing patients really love is the vibrational tool to distract essentially the brain away from pain signals. So they place this little vibration tool on their chest or on their arm or their leg, and this is gentle vibration. You believe how much this helps. So I'll have the patient hold that, and the patient can place it on her chest and just relax there, okay? And so when I do these injections, they're very fast, okay? So it's a very small needle, and the key is to snap the needle right in very quickly. See how quick that was? That's one injection. So when it's very fast like that, the patient really doesn't have time to think about it, and they're not going to feel much because the needle passes so quickly through the dermis. I'll do a few more. That's the glabellar area. And we'll place a little one here, and a little bit one right here, very fast. A little jerking motion of the fingers, not the arm, but the fingers. And let's have you raise up high like a surprise and relax. So again, also by using a left hand that's somewhere near the injection site, that's also distracting. Sometimes I can tap on the area with my finger, raise up high, and relax. Another technique is to wiggle the skin. All these are distraction techniques that make it very, very easy for the patient. Let's turn a little bit this way. And once again, when I do the crow's feet area, I'm going to wiggle, and inject quickly. And we're almost done with the whole thing. We'll go around this way, quick smile, and relax. I'll grab a little bit of the skin, we'll wiggle it, wiggle. So these are all techniques to reduce pain. That's the entire treatment. Let's get a wet one. That's the entire treatment in about a minute and a half. And then I just wipe the patient down, and that's the whole thing. And that's typically what a first experience here would be like if you started with a product like Botox or Dysport. There's generally no bruising. Sometimes a tiny bruise can occur here. And that's it. So how did we do there, Carrie?
Great, I didn't hardly feel anything.
Yeah. She's not being paid to say that. I hear it all the time. Okay. And so that's the snap technique. Also some vibrational distraction techniques. It should be easy. Ice is not necessary. Numbing cream is not necessary. It's really so fast that those things are just really beyond what is necessary for 99% of people. So if you choose to come in, that's kind of what your experience might be.